A Clarity Laboratories report brings together multiple sources of information for consideration when conducting a mental health assessment. Using the Achenbach system of empirically based assessment to collect data from multiple informants, psychologists at Clarity Laboratories create a report that provides vital information for the primary care doctor. Drawing upon the wealth of research using the Achenbach system of empirically based assessment and their own clinical expertise, psychologists analyze the data and generate a report that provides useful information in a concise, practical format. The first page of a Clarity Laboratories report provides a broad summary of the overall results. The observations of each informant are graphically compared with those of the other informants for each syndrome. The assessment results section highlights important findings. These findings include notations as to where in the report supporting evidence can be located. The recommendations section offers conclusions drawn from the evidence-based assessment. Recommendations include areas of interest to be investigated at subsequent appointments with the patient, as well as diagnostic considerations when combined with the information available to the primary care doctor. The recommendations section also includes suggested next steps for the doctor to consider on the basis of the information obtained from the evidence-based assessment. Following the overview provided on page 1, each of the behavior problem syndromes is examined. A narrative description of each syndrome accompanies a list of items which comprise the syndrome. The items are presented in rank order determined by the pervasiveness and intensity of symptom expression. These rankings help the primary care doctor identify target behaviors to be addressed in treatment. Along with a narrative description of the syndrome, Clarity Laboratories conducts an analysis of the pattern of results for the individual patient. This analysis examines the pattern of expression across informants and across syndromes. Such an analysis often reveals potential sources of problems that contribute to the presenting problem or complicate the diagnostic picture. In addition to the syndromes which comprise the Achenbach system of empirically based assessment, clinical scales developed from research and item lists generated from professional consensus are examined. These additional scales have clinical significance to the diagnostic process. Scales sensitive to the presence of pervasive developmental disorders, obsessive-compulsive disorders, and substance use are among the clinical scales. Item lists, such as the critical items list, identify individual items that are of clinical significance even when they occur in isolation. These items include self-injurious behavior, fire setting, and hallucinations. A Clarity Laboratories report provides the primary care doctor a wealth of information and depth of analysis in a timely, cost-efficient manner, and enhances the accuracy of mental health assessments being conducted in a primary care setting.